Yes, I'm still with you. Can you confirm that you can hear me?
Yes, we can hear you. The floor is yours, Hussam.
Thank you very much. First, I'll apologize for not turning my camera back on. The power is out, and I don't think anybody wants to see my floating sweaty head. Second, I
That's
want to
fine.
say thank you to the Arab Organization for Human Rights in the UK for inviting me to speak. And I also want to say that it's an honor to be speaking in a panel filled with so many distinguished people whom I personally hold an immense amount of respect for. Um, Having said that, I think for my talk, I'm going to try and situate us in terms of the humanitarian situation. Um, and it's important to look at the last few years. Many people on this call have spoken about the political, social, and economic aspects, and those all play into the humanitarian situation. Um, in 2018, before the revolution started, to put it mildly, Sudan was already in a difficult position. Since then, it's been affected by a number of crises, both global, national, and local. The COVID-19 pandemic, we had a 1 in 100 year flooding, intercommunal conflict began to spiral, particularly but not exclusively in the Darfurs. We saw conflict in the Kordofans, in Blue Nile, and other places as well. Um, we had disease outbreaks in a number of different locations. And so the humanitarian situation in Sudan has been deteriorating for some time before the coup. Since the coup, in last year's lean season, we saw more than 11 million people in what is termed as crisis conditions or worse levels of food insecurity. That is to say that they have inadequate amounts of food consumption. Um, and we are now, that is the lean season that we are now entering, actually. And so the timing of this conflict could not have been better, even if there is no good time for it. The 2023 Humanitarian Response Plan, which is the normative document for humanitarians in crisis-prone countries such as Sudan, estimated that there were going to be 15.8 million people in need of humanitarian assistance. This plan was prepared last year, again, before the conflict, and is going to be revised, and the numbers are going to be excessive. Some of our speakers have spoken about how critical Khartoum is to, at the national level, a legacy of decades of centralization. The reality is that whatever humanitarians are now going to be anticipating in terms of increased needs, it's probably still going to be worse because we cannot fathom how damaging this war is going to be, not just in areas of conflict, but even in the parts of the country that are relatively safe. It's incredibly critical medical stockpiles, supply chains were based in Khartoum, the centralization of several ministries, such as the Ministry of Education, the Ministry of Social Welfare, the centralization of financial flows means that what little service delivery was available to the different states is going to be even more hampered now. Uh, Irrespective of, as Khulud mentioned, the making Port Sudan the administrative capital, moving those things to Port Sudan, even if it is done, will take an incredible amount of time, and much of the damage will be done. We're seeing the same challenges around telecommunications and banking services that are critical. We are going into a planting season, excuse me, um, and the summer rains are going to be coming in, and many farmers who are dependent on funding as well as support from the central government are not going to be able to get it. That means productivity will go down immensely, again, all across the country, including in safe locations. Uh, the estimates for where Sudan was before the fighting are quite frankly bleak. It doesn't matter what sector you're talking about, whether that's food security and livelihoods, whether that's healthcare or nutrition. Sudan was already in a difficult situation. Before the fighting broke out, of the original humanitarian response plan, only 14% was funded. That means that a quarter of the way into the year, only 14% of the needs that that were of the people of the needs that were not just identified but targeted were not were filled. That is a huge gap. For this conflict to happen means that uh, not only will this gap need to be filled, but the amount of funding that's going to be needed to fill that gap will grow significantly. And this is before we go into the challenges that humanitarian organizations, both local and national, both local and international, are going to face during their time here. Um, Access is incredibly difficult, not just because of insecurity, but because of the fractured nature of the state means that bureaucracies are not put in place that enable humanitarian action right now. There's also a significant risk, and another speaker had spoken about the politicization of aid, uh, that aid is going to be weaponized as a is going to be weaponized by one side or the other. There's significant risks of aid diversion. Um, that is to say that uh, it is only in retrospective, or just only in hindsight, probably a year, 2 years from now, that we will truly understand the scale of the humanitarian crisis in Sudan. Um, like many others on this call, I'm not optimistic about the near-term prospects of this war ending. And so it is important that we focus now on how we are going to deliver for the people and children of Sudan. Uh, lots of people have spoken rightfully around the resistance committees who are now on the ground delivering alongside other civil society and community-based organizations, and are doing so with, quite frankly, very little support. Another speaker also mentioned how the humanitarians on the ground who are delivering are in fact Sudanese, and I think that's a very important thing to speak about. It's very easy to look at the images and videos of UN convoys evacuating international staff and say that INGOs no longer have a presence. The reality is the vast majority of staff, local NGOs and international NGOs, as separate from community-based and civil society organizations, are in fact Sudanese. They are in these conflict zones. Many of them have moved to the safety of safer locations outside of Khartoum. Many of them are now delivering in incredibly volatile places and contexts in Darfur's and the Kordofans, and even a few of them in Khartoum. While operationally, there's a very strict kind of distinction between non-governmental organizations and the civil society that are now delivering. The reality on the ground is that the profile of someone who wants to help their country and their community is often the same. And so a lot of the membership of these organizations are volunteers or staff in the local and international organizations who are on the ground and delivering, even if their organization is incapable of doing so. And it's important that we create a space and an environment where they can be supported and where they can deliver in order to mitigate, as humanitarian action can never really solve everything, but at least mitigate the effects of this horrific war. That means that increasing amounts of pressure has to be put, and other speakers have spoken about how that pressure might be applied on the actors to respect international humanitarian law. I'm sure smarter people than me can figure out how to do that, as this is a rather tall order. But it's also important that the international community and the regional actors step up at this time. Whether it is by providing funding, whether it is by finally pushing forward agendas that humanitarians have been speaking about for a long time. In this case, agendas such as localization that are going to be critical when it comes to delivery. The reality is that even the best funded INGOs will face difficulties implementing a number of these places. And they need to be able to support organizations that are operating in difficult conditions. And in order to do that, there needs to be a push from the donor community to reduce a little bit of the bureaucratic red tape, right? To talk about reduced compliance and risk measures that are rightfully there in place for most humanitarian implementation, or smaller youth-led organizations that have flourished during transition in Sudan. and are now using the time that using the experience they've gained those 4 years to deliver where many of us actually cannot. Um, Finally, I did want to stress a little bit on the necessity of ensuring that everyone is speaking on with the same voice. Some people have mentioned the uh, the UN Security Council meeting, and there is in fact dissent uh, between the different parties, and that's just not acceptable. There needs to be a bare minimum where we are advocating and working together in order to create uh, monitoring and reporting mechanisms and support existing monitoring and reporting mechanisms for that matter, including those that include civil society and local actors on the ground, uh, to ensure that we can, at the very least, in the future, hold the warring parties to account, to ensure that humanitarian aid, whoever is delivering it, reaches those who need it, um, and that perhaps for once the international community acts and the the INGOs act as a support system for the incredible work that is already being done by local staff across all designations of aid organizations, whether that's CSOs, CBOs, INGOs, LNGOs, or other actors that we haven't even mapped yet. Humanitarian work should not be the purview of any one group, nor should we pretend that there is these solid boundaries between them. The reality is that if even when there are operational barriers, delivery on the ground is done through mutual aid in an ecosystem, and that the future response should look like that. Because again, the humanitarian crisis in Sudan we have yet to see the full scale of the crisis in Sudan, and I shudder to think at how bad it will be. Thank you very much, Ruba.